Hello, this is Margie Meady recording the PowerPoint for Concepts of Psychobiology. In recent years, there's been a greater emphasis being placed on the study of the underlying organic basis for psychiatric illness, and that's what we're going to discuss in this PowerPoint. It's just a short, brief PowerPoint that helps you understand that there could be a physiologic basis for these mental health, emotional types of symptoms, and for you to keep that in mind. So I'm not going to review anatomy and physiology concepts. I'm just kind of listing a few slides here that you can use as an overview. So this is just talking about the nervous system, a review of the structures of the nervous system. And then this PowerPoint slide is just reminding you about the types of tissues that are involved in the nervous system, specifically the neurons and the types of neurons, and reminding you to make sure you understand what a synapse is and a neurotransmitter. And I talked about neurotransmitters in the psychopharmacology PowerPoint, and you should remember all of that from pharmacology class as well. This is a reminder of how we have physiologic reactions to stress and how our body responds to internal and external stressors. I talked about this a lot in pharmacology class, and I talked about this in the PowerPoint that discussed stress and adaptation to stress. So this is a similar picture to the one that we used in our pharmacology class that kind of reviews the fight or flight or the rest and digest reactions. And it's just meant to give you a nice overview of what happens when somebody identifies either an internal or an external trigger, something that that they're seeing as a threat, or whether they have identified that their internal and external environment is safe and they are able to conserve their energy and go into the rest and digest response. So again, neurotransmitters play an important role in our emotions and in our behavior, and they're the target when we are utilizing medication therapy. So it's where we're going to have that mechanism of action occur, because we're going to target those neurotransmitters to behave. We know how they behave, and we're going to try to either enhance them or block them, or whatever we're trying to do with the medication. Remember, again, I've said this over and over again, we aren't creating new neurotransmitters. We're not telling the neurotransmitters to do something they don't normally do. We're just trying to facilitate the way those neurotransmitters already react in our body. And so the medications are utilizing what already occurs and how our neurotransmitters impact our emotions and behavior, and we're trying to utilize medications to trigger neurotransmitters or block neurotransmitters. Some major categories of neurotransmitters are the cholinergics, the monoamines, the amino acids, and the neuropeptides. So this slide is just reminding us of the connections between the nervous system and the endocrine system. So with the nervous system, we have neurotransmitters that are regulating homeostasis, and with the endocrine system, we have hormones that are regulating homeostasis. And so I've listed some hormones that are associated with the different lobes of the pituitary gland here for you. This is just, again, reminding you of the connections between those two systems and how they both regulate homeostasis in the body. One of the other things to keep in mind is the importance of circadian rhythms in regulating hormone secretion and body temperature and sleep-wake cycle in a human's life. And so the circadian rhythm is something that we think about in anxiety and sleep disorders. And remember, we talked about the connection between anxiety and insomnia. So the sleep-wake cycle is one of the most common biological rhythms that demonstrates circadian influence. And we do want to keep in mind that there are neurochemical influences on the sleep-wake cycle. And I've listed here the serotonin and L-tryptophan, norepinephrine, GABA, and acetylcholine that play a role in the sleep-wake cycle. So remember, when patients have mental health psychiatric disorders, very often they have sleep disturbances as well. So keeping in mind how the body regulates these circadian rhythms is a good thing for nurses to have an awareness of. Another thing to keep in mind is that genetics has a role in determining how people behave. And remember that a genotype is the set of genes in a particular human individual, and phenotypes are characteristics that are not only genetic but may also be acquired. So a lot of times with mental health psychiatric disorders, we find out that there are familial tendencies, genetic tendencies, and how we figured out these etiologies, how we figured out that the underlying basis or causation of some of these disorders, as we've done studies, the familial studies, the genetic studies, twin studies, and adoption studies. That's what helped us figure out that, for example, if twins were separated at birth and both of them developed schizophrenia, that helped us to understand that there was a genetic influence to those underlying causes. And we've talked about how stress can impact the immune system. So we have a normal immune response that involves cellular immune response, humoral response, and antibodies. And how this influences psychiatric illness is that, as I've mentioned in the other PowerPoint, the stress triggers, suppresses the immune system. And so if people are undergoing large amounts of stress or repeat impacts of stress, then that can impact their immune system. So people that have psychiatric illness or mental health disease can have lowered immune systems, be more at risk for developing chronic conditions that or have their basis in a depressed immune system. So neurochemicals can also influence the immune system, and I've listed some of the different neurochemicals that can impact the immune system. And so we are also aware that grief, bereavement, and depression can result in decreased immunity, meaning people that are going through those types of conditions are at risk for infections and other kinds of conditions that are the result of a depressed immune system. We also know that the immune system can have abnormalities when people suffer from alcoholism, autism, and neurocognitive disorders. And so we don't really know exactly the relationship to the onset and the course of schizophrenia, but we do know that there is a relationship to the immune system and schizophrenia. And I talked about this in a separate PowerPoint, but we have medications that treat mental health psychiatric disorders. Antipsychotics were introduced in the 1950s, and again, they're intended to be used as an adjunct to individual or group psychotherapy. They aren't meant to be standalone. Remember that these drugs do not cure mental health conditions, mental health illness, but they alleviate the symptoms and help people be more responsive to individual or group therapy. So again, they're used in conjunction with other types of mental health treatments. The role of the nurse is that there are very specific ethical and legal implications involved in psychopharmacology. The nurse plays a role in assessment and in medication administration and evaluation and in client education. This is again some repeat information, but psychotropics work by having their action at the neuronal synapse. Antidepressants block the reuptake of serotonin and norepinephrine. Antipsychotics work by blocking specific neurotransmitter receptors. Benzodiazepines facilitate the transmission of GABA, and psychostimulates increase the release of norepinephrine, serotonin, and dopamine. So what we want to think about here is that psychiatric nursing wants to ensure a smooth transition from psychosocial approaches to biopsychosocial approaches. In other words, we do treat the symptoms, the emotional symptoms that people have, but we also want to consider the physical or biologic impacts of mental health illness on a person's body. So again, grief, depression, those things impact the immune system. We don't want to just treat emotional or behavioral symptoms, we want to also think about that person as a holistic individual and what kinds of other ramifications do these conditions have on the body. New science and technology has to be incorporated into our nursing practice. We have to provide education about this new science, these technologies and the research. And so if you are working in the psychiatric field, you have to have specialized knowledge about all of these different kinds of influences, these biologic influences on a body. So we'll end with a couple of questions. A nursing student is learning about the human limbic system. Which student statement demonstrates that teaching about the function of the limbic system has been effective? And the correct answer is A. The limbic system is the emotional brain and can help in stabilizing emotional behavior. So again, making sure that you understand anatomy and physiology and how it relates to the symptoms that people might be experiencing. So this question is, a client is brought to the emergency department and diagnosed with a panic level of anxiety. What biological system domination would be responsible for this diagnosis? And if you consider these answers, the correct answer is B. The sympathetic division of the autonomic nervous system is the one that's dominant in stressful situation. Remember, that's the fight or flight response as it prepares the body to respond to that threat. If in the situation presented, this client is experiencing panic anxiety, and therefore the sympathetic system is dominating. Remember, the parasympathetic is rest and digest. So thank you very much for your attention. I hope you found this PowerPoint beneficial.